So I think there are a number of different approaches to the abdominoplasty surgery itself. Often, there's two components where number one, we have to discuss the incision, and the incision often will be sitting quite low in the abdomen. Then there's a question of how far does it extend, to the side of the chest wall, and whether there is any associated, excess skin on the lower back that may require, converting into something called a circumferential, abdominoplasty. So that's obviously a much more extensive surgery. There are sort of some occasions where we may need to consider a lot of the excess skin in the what we call the vertical plane as well. And some of the patients might have heard about a process called Fertilise, and that includes having to have that longitudinal cut in the central part of the tummy to remove that excess skin as well. Although my personal philosophy is that I really try to avoid the incision, because I think aesthetically that's not as pleasing as trying to hide a scar in the lower abdomen. But certainly it is being described as a technique. That's sort of things that we do to address the skin, and now often that may be enough to address the issue, but sometimes there may be some extra tissue on the lateral chest, on the sort of lateral abdominal wall, in the flanks area, what we call it, that may require some additional liposuction to try and address that. So that may be sort of added to the surgery if that was indicated. I think the other area that are sort of part of the abdominoplasty discussion is what to do with the Mons area, which a lot of patients come in complaining about, the ptosis in the Mons area as well. And sometimes they could be addressed, with a small lift at the same time with the abdominoplasty, but sometimes that may be something that needs to be addressed separately because of the degree of the sagging, in the Mons area. So often I'll tell patients that we need to really get the lower abdomen skin sitting properly first before we come back in the second stage to address the Mons. And I think finally, in any of these surgical incision that I use, I will always still look at the degree of separation in the muscle, and I will always try to address that muscle separation by tightening up the muscle, because I think that's a very important part of the whole surgical process in order to number one, improve that abdomen support, the muscle support that is obviously very important for our core, but also really just to reduce that distension that often can be seen associated with some of these conditions. And so by repairing that muscle together, that will also help to improve that side profile and reducing that distension that can be seen on the side profile as well.